Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers. Today we're going to talk about Social Security and the Senior Medicare Patrol. We thought it would be timely to have today's guests on because Social Security, in an effort to find more efficiencies in the program, has been promoting the Go Direct program for direct deposits of benefits. And we will cover some general Social Security questions as well. In addition, we also have a guest from the Senior Medicare Patrol program who will talk about the ways that program can prevent Medicare fraud and abuse. Today, we are joined by Carl Robinson, Public Affairs Specialist of the Social Security Administration, and Charles Clarkson, Project Director of the Senior Medicare Patrol of New Jersey. Thank you both for being here.
Thank you for having us.
Thank you. We want to really start the conversation today with some of the basic questions about Social Security. So perhaps, Carl, you could tell us how someone enrolls in Social Security at age 62 or 65?
Surely, Grace, and I thank you for the opportunity to share this time with your viewing audience on behalf of Social Security. One of the ways that is most convenient and one of our more popular ways is for people to file right online by accessing our award-winning website, www.socialsecurity.gov. You can file in the privacy of your own home for most of our benefits. As you mentioned, a person can file as early as age 62 or at different ages up until full retirement age, which varies according to a person's date of birth. And also some people delay until age 70.
Right.
But once that planning stage is done on an individual basis, then a person in the privacy of their own home can file by accessing our website.
And I know we didn't talk about this earlier, but I understand there's some widow's benefits that are also available at age 60.
That's true, Grace. Interestingly enough, and we mentioned this before, when you talk about Social Security benefits, it's really a program not only for our seniors, but also that virtually affect every American family. When you look
That's
at
true.
people receiving benefits at this time, almost 40% are other than retirees. So what you can do in terms of benefits of filing online are retirement, spouses benefits based on age, and also disability and Medicare benefits. But specifically the benefits you mentioned at 60 would be for widows benefits. A widow based on his or her age, a widow or widower can file as early as age 60. And again, many people, when you talk about dependents and survivors, after all, Social Security, one of the basic things that never changed about Social Security in its 70-plus years is that it's a replacement of lost income.
Right.
And right now it's lost income due to death, retirement, or disability, not only for the worker, but for their dependents and survivors as well.
And I know I asked you off camera how long you've been at Social Security. So, I mean, these things are pretty stable since, how long have you been there?
Well, I've been there 38 years,
Yeah,
so that's
exactly.
almost half of Social Security's entire history.
Yeah. But now Social Security really wants people to have electronic payments, and so that's what the Go Direct program is. So can you explain a little bit about that for our viewers?
I'd be happy to do that, Grace. Actually, it's based on a Treasury law, and effective March of 2013, with minor exemptions and just a very few exceptions. All people on Social Security benefits who receive Social Security benefits will be required to get direct deposit or have their funds received by electronic transfer.
And how does that work? I mean, how do people sign up for it?
Well, people can use their own bank accounts, which is the traditional way for a lot of people to do it. In anticipation of these new Treasury laws, there's a program called Direct Express that you may be familiar with. And people can access the Direct Express procedures by contacting the Social Security office. That's one of the ways they can do that. And they can actually, people who are entitled to benefits can actually go right online, www.socialsecurity.gov, and sign up either for direct deposit or through the Direct Express procedure. But why wait till 2013?
Well, exactly. That's why
Do
we're
it
talking
now.
about it.
Do it now.
The Direct Express card, is it like a debit card?
It is exactly very similar to a debit card. It's done for the purpose of a bank, Comerica Bank, in that the debit card actually allows people a means to pay their bills, to take money out of their account. And what it's done with, since it's associated with federal programs and federal mandate, federal law, it's actually done in the purpose of trying to minimize fees, so it's an alternative to direct deposit for people primarily who don't have direct deposit.
And it means maybe they don't have a bank.
It could mean that. It could be.
So
that
you could have it even if you now get a check, but you take it to a cash place, check cashing place. I mean, how does that work?
Well, actually, it would be through a bank and the means that a person would use to pay the bills. And basically, it works as a debit card would be done for merchants who accept that debit card, which is a lot of merchants. And it's really in lieu of check cashing. The cost for people who do this, who don't have bank accounts, the fees in some instances would be zero. And to cash a check can be an extremely high amount for a check. So it's really done for two purposes. One, to comply with the federal laws, the Treasury laws in 2013, March of 2013. And it's done so it can be received electronically, and so that it's negotiated for minimum or no fees. There are some fees, but people who want to minimize those can actually do it free. Now, by accessing that Direct Go on our website, it'll explain that in detail. So that's how people can do that on the internet.
I know we're going to talk a little bit about Medicare fraud and abuse, but it makes me wonder, do you see Direct Express as tackling some fraud issues for Social Security?
There's no question about it. With not only Direct Express, but also with direct deposit, and approximately well over 85% of people currently have direct deposit or Direct Express at this time. Not only does it eliminate fraud in a lot of situations, but it also eliminates stolen, lost checks. So that's why I say don't wait till 2013. Pick a bank of your choosing, or if that's not appropriate or it's not feasible, then learn about the Direct Express procedure. In fact, Grace, in May of last year, we're actually mandating new individuals through the Treasury law, the same Treasury law that we're speaking about, to sign up for electronic transfer of money through either Direct Express or direct deposit.
Okay, I want to get a clarification. Did you say in your last comment what percentage of people already have electronic and direct deposit?
Nationwide, it's approximately 85%.
85%. So it's really reaching out to that 15% or those new enrollees now.
Absolutely, and interestingly enough, in response to one of your earlier questions concerning the reduction of fraud, we spend, if you go to one of our field offices throughout New Jersey, we really spend a great majority of time servicing the 15% of the people who don't get checks by electronic transfer. So it really makes sense, not only for the government, but also for the recipients as well.
Right, because you don't want to burden the local offices either. You really want things to be taken care of. Again, the Direct Express card, do people need to have a bank that they're working with to get that?
It's actually one bank that we use nationally for the purpose of receiving not only Social Security checks, but other federal benefits as well.
Right. Are we talking about railroad?
Railroad, I believe, is one of the ones that's covered. VA.
The veterans benefits.
Veterans benefits.
And
And SSI as well, which is another program that's administered by Social Security, but comes from a different funding source. That comes from general revenues as opposed to the Social Security tax that we take out of your pay stub each month or each pay period.
It definitely sounds like an efficiency that would help everyone from
Right.
what you've
And,
said.
you know, you're right, Grace. It would help the local offices, but more important, it safeguards the recipient's checks. We feel it does eliminate fraud. You could have a check that's misplaced, stolen,
Right.
lost.
I think there's some other interesting pieces on your website. I was looking recently, and I know we've addressed it in Renaissance Magazine, the SS Social Security Estimator. And so how would that work if I went on there or one of our viewers went on? What would they learn?
Well, I thank you for mentioning our website, and I'm glad that you enjoyed it. It's an award-winning website that I mentioned before, www.socialsecurity.gov. And if you access that website that I think you can see right on your screen, one of the things that we talked about, since Social Security is for all working families, is that people start planning their retirement as early as possible.
Right.
So one of the things that you've asked and we've talked about, should I take benefits at 62? Should I take benefits at another month, another age? Well, you can use that estimator not only to find out what it is at different points in time, but you can use that estimator to compare what would happen if I stop work at 62.
Right.
You can actually use it as a proactive way of comparing different things.
A planning tool.
A planning tool, thank you. Exactly, a planning tool. And it's just a wonderful tool. And I would recommend people go on that immediately. As soon as you access the website, you can look at right on the left-hand side, and it's the retirement estimator.
Okay, great. Well, I think that's really helpful. I am very pleased to have both of you here, and I think there's some crossover in terms of interest, but I know Charles has been involved with the Senior Medicare Patrol, and you know, Medicare fraud and abuse is obviously a big issue, but can you tell us, I know the Medicare Patrol is not that old, so how...
No, actually, the Senior Medicare Patrol and its former names were
We'll come back to you.
was actually started in 1997. The federal government said, hey, we need to do something about fighting fraud, waste, and abuse in Medicare, because the program was getting very expensive, and people said, you know, the future doesn't look good unless we do something to fight fraud. And one of the things that it's good about the Senior Medicare Patrol now is that we're finally getting some recognition, because fighting fraud, waste, and abuse is now a priority.
How long have you been doing this, though?
I've been doing this for 8 years.
And before that?
I was an attorney. I was
Okay.
general counsel to Beatrice International Foods.
Oh, okay.
So basically
Corporate law and now Senior
Right.
Medicare
Well,
Patrol.
I basically, when my company was sold, I was out of a job, and I took some time off. And then my wife kicked me out of the house and said I had to take a job, and she was the president of the organization.
She was right. Huh?
She was the president, and she
okay.
said, get the hell out of the house. You're driving me crazy.
Okay, and so you obviously have embraced the mission of the
Yes.
Senior Medicare Patrol, and obviously abuse and fraud is part of it, but how do you accomplish this?
Well, basically, you know, we have a staff and also volunteers that we train, and we go throughout the state. Remember, ours is a statewide program. It's funded by the U.S. Administration on Aging, and we give presentations to all types of senior groups, private clubs, churches, synagogues, anybody who will invite us. And
Anybody who'll listen?
Anybody who'll listen and invite us, and we tell the audience, if you belong to a senior group, call us. You know, just call me up. It's 732-777-1940.
Another number across the screen.
Right,
that
ask
people
for a
can see.
Senior Medicare Patrol, and basically we'll schedule a presentation for your group. It's totally free, and we'll do it anytime, day or night. And we'll go out, and like I said, all the way from Cape May all the way up to Sussex County in the north. So, and please, that's what we're here for. And we do hundreds of these a year.
Yeah, hundreds. I've seen your list. I'm just curious, you mentioned volunteers, so how do you utilize volunteers?
Well, basically we have, you know, we try to recruit volunteers by ads in magazines and websites, and then we give them a full 2-day intensive training. They have to pass a test or an assessment, and basically we ease them into the program. They can do whatever they want. They can stuff envelopes all the way to doing presentations,
okay.
and they could also do complex issues. You know, besides education, we actually help people resolve issues with Medicare. So if you have a case that you were double billed and your doctor isn't cooperating, you can call us up and we'll assign a volunteer to basically look into that and help you try to get through that and resolve that issue. And
Do you do those at the presentations, or do you
no,
do
no, we
that
do those at people, we mention that at our presentations, and then people call us up. And not only that, we have an arrangement with Medicare. So if you call up Medicare and say, look, I have a fraud issue, Medicare will now refer that case directly to the Senior Medicare Patrol of the appropriate state that you're calling from.
Oh, really?
Yeah, so we are getting a lot more calls, and sometimes it's just questions. You know, I don't understand what happened, and we can answer their questions. So I tell the audience it doesn't have to be fraud, waste, and abuse. Medicare is complicated.
Right.
If you have any questions about Medicare, call us. Let us help you. If we can't help you, we'll refer you to an agency or a place that probably can help you. As you know, we partner with the SHIP program, the State Health Insurance Assistance Program. So they also know about the insurance side, and we basically do the fraud, waste, and abuse side.
And the SHIP counselors are really based in the AAA, so the county offices on aging.
Yeah, well, it depends. You know, they usually are based in AAA, but they get volunteers from a lot of places, and they train them usually through the county offices on aging. And every county has a SHIP counselor.
Exactly.
So you can go to any county, but a lot of people, you know, call us up and they have questions, and when I say to them, well, this is more of an insurance question,
Right.
let me refer you to this other partnership that
SHIP.
we have, because, you know, it's not a fraud issue, and we're really funded to do the fraud issues.
Right. And I would presume there are some concrete examples of fraud and abuse that you've seen over your years.
Absolutely. You know, Medicare estimates they lose $60 billion a year
Really?
to fraud, waste, and abuse. So, you know, just from a simple, the doctor's office bills you twice for the same procedure on the same day. It might be a mistake, it may be fraud, we don't know, okay? You got billed for a service that you never received. That happens a lot.
Medical equipment that you didn't get?
Medical equipment is a very, very big area of fraud, waste, and abuse. And actually, the federal government is looking into that issue because there is now a pilot program where there's going to be an approved suppliers of durable medical equipment, or
really?
we call DME. But that hasn't arrived in New Jersey yet. But eventually, because it's going to be a bidding contest, you know, Medicare said, well, we're paying much too much for this equipment. We're going to let people bid, and whoever has the lowest price, that's what we're going to accept. And then you're going to go to these approved suppliers, and they think that's going to save billions of dollars. And it is, like I said, a pilot program, so we'll get the results soon. It'll be rolled out nationally.
Where is
Well,
it
there are a lot
pilot?
of zip codes. I can't even.
Oh,
you know,
I mean in New Jersey?
No, not in New
okay.
Jersey at the moment. So right now you can go to any supplier, but in the future you have to be very, very careful, or otherwise Medicare won't pay for it.
Right. And what do you tell people to do if they suspect abuse besides calling you?
Well,
what's the
you
next
know, the
step?
first thing you'd like to do, I mean, if you read, well, if there are a couple of rules. Number one, always protect your Medicare number. But the second
Or your
thing,
Social Security number.
which is really your Medicare number with a letter, which has a certain meaning. And then the most important thing is you have to read your statements. Your Medicare summary notices come every quarter after you see a Medicare provider, and read it carefully. Because if you don't read it carefully, then whatever mistakes or fraud that you're being billed for, they're going to get away with it. So if you see something on your statement and you say, you know, I never got that test, well, call up the provider and say, hey, you made a mistake. I wasn't there that day. I didn't take that test. I want this bill corrected. And if they're a good provider and they're honest and they realize they made the mistake, they should correct it. Now, if that doesn't work, you can call up Medicare, 1-800-MEDICARE, and you can make a complaint. But like I said, now they're referring those cases directly to us, so just call us.
How would you know if it was corrected? Would you get another statement?
Yes. One of the things we have to do is follow up. We have to make sure that the next statement shows the credit.
Got
And
it.
I say, people, just because the doctor says he'll correct it, that's not enough. I want to see the revised bill. And I want to make sure that I got the credit and that Medicare got the credit. So, you know, and it does take work, but we all have a stake in Medicare.
Absolutely.
And if we don't take care of Medicare, then maybe in the future it won't be there for us in the same form it is now. And therefore, we're all going to suffer, because nowadays when most people retire, this is how we get back. Most people retire, they might not get the same kind of benefits that your grandparents got or your parents got, because now companies can't afford it.
Right.
So when you leave a job, you may not get any health benefits. So Medicare becomes even more important as current generation gets older and starts retiring, which you know the baby boomers are. So Medicare is going to be even more important in the future. So fighting fraud, waste, and abuse and saving money for Medicare is important to all of us.
Well, I want to go back to your description of your presentations for a second, because I have met some of your staff, and are you able to offer bilingual assistance?
Yes, we have a Spanish outreach person who does strictly Spanish outreach. We also do minority outreach, for African Americans. We also have a Russian-speaking person in the office who can do Russian. So if we can't do every language, but we do have paperwork that we hand out and information that we can hand out in various languages. Obviously, most of our things are done in English, and now a lot of it's in Spanish, which are the two main languages that we really focus on.
And I think that's really helpful for people to know that that you have material that can really address a variety of these pieces.
Right, and we hand out materials at every one of our presentations because it has our name, our hotline. We have a new fraud hotline, which is toll free. It's very, very important. Please call us. If you need help, it doesn't have to be fraud, but if you have questions, let us help you. Because when you enroll in Medicare, you have to make a lot of decisions, and then people realize after the fact, oh my God, we missed open enrollment. What do I do? How do I do it? I have an issue about I was billed for this. I never got paid. So there are a lot of things that we can help with.
Well, I know you've shown me how the Medicare
Medicare Part D comparison online. People now have a program called Part D, prescription drug plan in Medicare, where they can sign up for prescription drug coverage. But every year those plans change. And we tell people every year, do a comparison. Check one plan and then see what plans are available the following year, because everything changes. The premium, basically the list of drugs in the plan, the formulary changes, the co-pays change, the deductible change. So you always want to make sure you're in the best plan, and you can change every year, during the open enrollment, which always starts January 1st and goes through December 31st of the year.
What I thought was interesting on the website was that it also allowed you to compare the plans.
That's right.
That you could actually see
when you put it, what the plan does is basically says, what drugs are you on? Okay? Where do you live? What drugstore do you use?
It's interesting that
and then you can basically see, and remember, the most important thing is not the premium. It's the estimated annual cost of the plan, and then you want to pick the plan with the lowest estimated annual cost with all your criteria that you put in, and then you just basically switch plans online or call up the plan, and it happens automatically, and the old plan is terminated, and you'll be in the new plan. But obviously, open enrollment is ended, so it's not until next year.
Not until next year, but I think it's interesting that the website can do all of that, including showing you your local pharmacies and I don't know, does it show you the cost of the drugs at those pharmacies?
Yes, you can look up the cost of the drugs,
so
absolutely.
It's just really a very helpful tool.
It is. You really cannot sit there and compare 30 plans by doing a spreadsheet and trying to call every plan.
Not at all.
And they only know about their own plan.
Exactly.
So that's not the way to do it. So we help people during open enrollment to do a Part D comparison.
And I just think that it's really very nice. Of course, you have to have access to a computer.
That's right.
But there are an awful lot of public libraries and county libraries that have that. I know many senior centers also have computers.
Right. Well, every year, people who don't have computers call me up and say, can you do it for me, Charles? And I sit there on the phone with them for about a half hour, and I do it while I'm on the phone with them. And I either fax them the results or mail them the results, and then they say, that's a great deal. Roll me right now. And I just do it right online while they're on the phone with me. So it works quite well.
Well, and I know you also do it when you go to presentations, but do you and Social Security ever go to these presentations together?
Actually, we did a joint presentation with the Social Security Administration in Patterson. The person there from Social Security, Everett Ho, I think was the name. Everett Lowe. He did How Do You Enroll in Social Security, and we did How Do You Enroll in Medicare.
Right. So this sounds like although you've done it in the past, it sounds like something you could,
Absolutely. I've already given him my card. I said, let's do things together.
Absolutely, Charles. And we really have the same mission. And the website that you mentioned that your viewers can see at this point, we actually handle a piece of the Medicare prescription plan, Extra Help in Medicare Savings Program.
There you go.
And seniors can actually do that right online on www.socialsecurity.gov.
I noticed when I went online, there were some other websites. When I went, there were like Social Security Solutions and different things. It seems to me that should people just go to the socialsecurity.gov? I mean,
Well,
is that the safest site?
I think it's important to remember that's the only official
That's the point.
website, and that's where
Right.
you get it. You can get our programs, rules, and regulations,
Okay.
and that's the official site. So
Right.
that's when you want
Right.
the specific information, you know it's government-sponsored, it's
Right.
government-vetted.
And it's secured.
Social Security vetted, secure.
And that's
Thank you.
true with Medicare too. You know, there are a lot of agencies out there
Right.
like the Medicare Rights Center and things like that. But
Right.
if you go to Medicare.gov,
Right.
you'll get the official site and you'll see all
Right.
the information about enrolling in Medicare, the comparison, everything is on the site.
And one last thing, you don't have to pay anybody to help you sign up for these things.
That's one of the things
I think that's important.
Right. One of the big scams that we talk about is please don't pay for something that you get for free.
Right.
That's why you have the SHIP program. That's why you have this Senior Medicare Patrol
That's why you
program.
have Social Security.
And
And that-
Social Security, because you know that's what the government is there to help you enroll in these
Right.
programs that you've paid for
Right.
all your working lives.
Exactly.
I think Charles actually worded that very well. You know, you paid for that. That's a service that's provided. It's official, it's free. And as you mentioned, Grace, that there's other things you can do online so your viewing audience can look at that list,
Scroll
which
down and see.
includes Go Direct,
There you go. So-
signing up for direct deposit and other benefits. Plan, calculate, and for the vast majority of people, apply right online.
Well, I really want to say thank you very much, both of you, for being here.
Thank
I
you.
think it's a very informative show and an important topic for our viewers. So I would like to, remind people that, they can also go to find out about senior services in their area by contacting their county offices on aging or under their new name, some of them, the Aging and Disability Resource Connection. You'll see a listing of their numbers on our website. And you may call the state hotline number, which is 1-877-222-3737 to reach the County Office on Aging in your area. I also want to ask our viewers if they have suggestions for this show. We can certainly ask you to call us at our number, which is 1-609-421-0206, or you can email us, and you'll see our email and website at the end of the show, in case you have suggestions for future programming. We want to appreciate and thank you for joining us for this edition of Aging Insights. So until next time, send those suggestions and take care. And remember, aging is everyone's business.